Coronavirus is a common term for a group of viruses, which are usually found in animals and cause severe health disorders when transmitted to humans. The transmission of viruses from animals to humans is called an animal origin. Coronavirus is one of them. On Sunday, the Chinese authorities announced that the new coronavirus had killed 811 people in China. The outcome exceeds that of the SARS epidemic in 2002 to 2003 worldwide. In the 2 years 2002 to 2003, I harvested severe acute respiratory syndrome, SARS, that belonged to the coronavirus. To the same strain, the virus has killed 774 people worldwide. Many coronaviruses are present in animals and do no harm to them. However, it sometimes turns into fatal strains. And when these deadly strains of corona come into contact with humans, they affect them with mild to severe symptoms ranging from common cold to acute respiratory disorders and pneumonia and up to death. The World Health Organization confirmed that it was collecting additional information on the deadly virus to help them understand ways to treat it. In this context, answers are made to 20 questions related to the new coronavirus. 1. What is the name of the new coronavirus? The term new coronavirus has been coined with the undetectable strain of the new coronavirus, which recently appeared in Chinese Wuhan. As this virus has not been identified yet, it has been decided to name it 2019 CoV-2. What is SARS? The term SARS-CoV coronavirus means severe acute respiratory syndrome. It is a deadly and epidemic infectious disease. 2002 outbreak in China and all over the world, after moving from bats and civet cats scattered in tropical Asia. 3. How similar is the new corona to SARS? SK virus belongs to the same family of viruses that cause SARS, but it's not the same virus. 4. How dangerous is the new coronavirus? New coronavirus can cause mild to severe symptoms in people who have the virus. The mild symptoms of a coronavirus are usually flu-like. These include runny nose, cough, sore throat, and fever. But when symptoms become severe, they lead to breathing difficulties, pneumonia, or death. 5. What are the most common hive cases? They have weak immune system diseases, diabetics, and respiratory disorders. 6. Is the coronavirus transmitted to humans from an animal source? However, this does not mean that coronavirus can be infected by domestic animals or any animals at all. Researchers believe that the 2019 COVID virus probably spread from the animal and seafood market in China after the first case of the human immunodeficiency virus was diagnosed. However, this does not mean that coronavirus can be infected by domestic animals or any animals at all. However, given that the previous cases of coronavirus were from an animal source, and it is believed that 2019 COVID was also transmitted from an animal, it is best to avoid any direct contact with live animals on the seafood market or the surfaces in contact with these animals until the source of the infection is accurately identified. Experts also advise to refrain from eating any seafood without good cooking. 7. Is the new SK virus infection transmitted from one person to another? The answer is yes. The new coronavirus is infectious from person to person, and the reason is that it mainly affects a person's respiratory system and causes common cold symptoms such as sneezing and coughing. When a person sneezes or coughs without any protective mask, the infected respiratory droplets come out and spread to the people around him or who come into contact with the things that the affected person used. Mists from the respiratory tract infected with the virus can be secretions, sneezing, coughing, or saliva. 8. Who are the people most susceptible to corona infection? People who have been living or traveling to China since the outbreak of the disease are more likely to become infected. The infection is more likely to spread among people who communicate closely with travelers from China, like their family members or colleagues, doctors and nurses, who provide medical care to patients with the new coronavirus. 9. Do the protective masks protect against corona infection? The World Health Organization recommends wearing protective masks to reduce the spread of the disease. Although it is somewhat effective, however, it does not guarantee the prevention of proliferation completely until the completion of other preventive measures. Wearing masks, however, provides two-way protection, meaning that they prevent the spread of coughing or sneezing masks. At the same time, it protects against the entry of infected fluids from others into the nose or mouth of the wearer of the protective mask. 10. How is the infection transmitted by sneezing or coughing without wearing a muzzle? When an infected person sneezes or coughs, who does not wear a protective mask, drops and droplets from the affected respiratory system fly and settle on the surrounding surfaces and objects. And when a second person touches these surfaces without attention, then touches his mouth or nose, the virus passes to that person's respiratory system and infects him. 11. How long can the virus survive on the surface? The exact period of time for the coronavirus to remain active on the surfaces has not been determined. However, some information indicates that the coronavirus may live for a few hours on surfaces. Cleaning infected surfaces with a simple disinfectant may kill all viruses, so that they cannot infect others. 12. How to distinguish between flu and coronavirus symptoms. Symptoms of both influenza and the 2019 COVID include colds, runny nose, fever, coughing and sneezing, which makes the diagnosis very difficult between the two. However, some tests help to detect if there is an infection with the coronavirus in the body or not. 13. What is the incubation period of the coronavirus? The incubation period indicates the time between infection with the virus and the onset of symptoms. Experts estimate the incubation period for the 2019 COVID virus to be 14 days. So the risk is that an infected person can transmit the infection before symptoms appear, unlike most viruses that spread after symptoms develop. 14. Is the infection transmitted through parcels or goods bags purchased China or other infected countries? Recipients of mail parcels or goods from countries infected with the virus are unlikely to be infected, as the virus cannot stay active and cause infection on objects or surfaces for a long time. 15. Do antibiotics treat the symptoms of the coronavirus? Antibiotics are antibacterial drugs that are mainly used to treat infections caused by bacteria, not viruses. So doctors do not recommend the use of antibiotics to treat symptoms. 16. How can coronavirus be treated or prevented? No medication has yet been developed to treat the infection caused by the new coronavirus. But some medications can be used to treat the symptoms of hive infection. The best way to prevent a 2019 COVID infection is to maintain personal hygiene. According to a recent report, a person with the new coronavirus in Thailand was treated within 48 hours. After receiving a combination of recognized anti-hive drugs, lopinavir and ritonavir, along with a flu drug called oseltamivir. 17. When should laboratory tests be performed to check for the possibility of corona infection? If a person has flu-like symptoms and lives in the affected area, or was in close contact with people visiting any of the affected countries, or was among those involved in providing medical care to the affected people, it is recommended that a test be conducted for 2019 COVID-18. What are the preventive measures for coronavirus? Maintaining personal hygiene is essential to prevent the spread of the coronavirus. The following should be done. Wash hands with alcoholic soap and water. Avoid direct contact with patients. Staying home for those who are diagnosed with coronavirus. Avoid spreading the virus to the person by avoiding close contact with family members or others. Cover the mouth every time before coughing or sneezing. Avoid touching the mouth, eyes, or nose with unwashed hands. Use antiseptics to clean surfaces and surrounding objects. 19. What happens to those who are found to have coronavirus infection? Patients who are confirmed to be infected with the 2019 COVID virus are isolated in hospital sections. Healthcare experts involved in providing care for these patients are advised to wear protective masks and gloves while providing treatment and medication to them. 20. Is the coronavirus a development or complications of the flu? The answer is no, as people who suffer from influenza but have not visited any country or location where the virus is spread or has not contacted an infected person. They are less likely to get a new infection. According to news reports, many people who have traveled from China to their countries have flu-like symptoms. But when laboratory tests were done to confirm that they were infected with the new coronavirus, the results were negative.